Scientists are monitoring why Europe's heatwave killed 5,764 people, and the single most important thing to understand about that number is that it is not final. It will almost certainly rise, possibly by a significant margin, and the reason why reveals something deeply uncomfortable about how modern societies actually track the true cost of extreme heat. Because the official number you see in a headline today is often only a fraction of the number researchers eventually confirm months later. Here is where that figure comes from. Public health authorities in Germany reported an excess death toll of thousands during a single 7-day period when this summer's heat wave peaked, a number that ranks among the highest single-country tolls recorded anywhere in Europe during this event. Excess mortality, the specific measurement behind this number, is not simply a body count taken from death certificates. It is calculated by comparing how many people actually died during a specific window against how many would normally be expected to die during that same period, based on historical averages. The gap between those two numbers is what researchers call excess deaths, and it has become the gold standard for measuring the true toll of extreme heat, precisely because heat itself is so rarely the officially recorded cause of death. That last point is the key to understanding why this number keeps climbing after the headlines fade. Heat is almost never written on a death certificate as the primary cause of death. Instead, extreme temperatures place enormous strain on the human body, forcing the heart and kidneys to work harder as the body tries desperately to keep itself cool. That strain worsens existing health risks from chronic conditions and can trigger acute kidney injury on its own. Researchers have linked heat exposure to increased mortality from respiratory disease, cardiovascular disease, and even dementia and Alzheimer's complications, none of which typically get recorded on paperwork as heat-related, even when heat was the underlying trigger that pushed a vulnerable person's body past the point it could recover from. That is precisely why public health authorities and climate scientists cannot rely on death certificates alone to capture the full scope of what a heat wave actually costs in human lives. Instead, they wait for complete mortality data to become available, sometimes weeks or even months after the event itself has ended, and only then can they run the statistical comparisons needed to identify the true excess death toll. This is a deliberate, methodologically sound process, but it means that whatever number gets reported in the days immediately following a heat wave is almost always an undercount, sometimes a dramatic one. To understand just how dramatic that undercount can be, look at how confirmed deaths compare to eventual excess mortality figures from this exact same event. In France, official public health authorities initially attributed a relatively small number of confirmed deaths directly to the June heat wave, including tragic individual cases like 2 young children found unconscious in a hot car and several elderly residents who died during the peak temperature days in the Bordeaux region. The cumulative confirmed death toll from both this year's May and June heat waves combined initially sat at only a few dozen officially confirmed fatalities. Yet France's own National Public Health Agency, once excess mortality analysis was applied to the same event, reported over 2,000 excess deaths during just the single week when the heat wave peaked in June. That is not a small discrepancy. That is a gap of roughly 100 times between the initial confirmed death count and the excess mortality figure calculated using proper statistical methodology. The World Health Organization has been explicit about this pattern, stating plainly that official confirmed death counts released during a heat wave consistently understate the true toll, and that final excess mortality analyses, once complete, typically produce death tolls that run 10 to 30 times higher than the preliminary figures reported while the event was still unfolding. Germany was not alone in reporting a severe toll during this same window. The Netherlands recorded several hundred excess deaths during the identical 7-day period that produced Germany's staggering total. Separate analysis from climate researchers found that France saw well over 2,700 heat-related deaths across a longer 17-day stretch in June, and researchers studying the United Kingdom's May and June heat waves separately estimated roughly 2,700 heat-related deaths there as well, with climate scientists calculating that a substantial share, around 42%, of those UK deaths were directly attributable to human-caused climate change rather than simply summer heat in general. That attribution piece matters enormously, because it is not just a moral or political talking point, it is a specific, quantifiable scientific finding. Researchers studying a 2018 heat wave in Zurich, Switzerland, found that roughly 27% of deaths during that event were linked to human-caused climate change specifically, separate from the baseline risk that any hot summer would carry. A separate study examining a 2021 heat wave in British Columbia estimated that 11 to 15% of deaths during that event were attributable to climate change. These percentages come from a growing scientific field called extreme event attribution, which uses climate modeling to estimate how much more likely or how much more severe a specific heat event became because of the warming that has already occurred, effectively separating the portion of a death toll that would have happened. Anyway, from the portion that exists, specifically because the climate has changed. If content like this, the kind of careful, methodical science behind numbers that most headlines report without any of this context, is something you want more of, go ahead and like and subscribe so you catch the next one, because understanding how these figures are actually calculated changes how seriously you should take every heat-related headline you see this summer. To put this year's death toll into historical context, you have to look back at how previous major European heat waves eventually had their final numbers revised. The 2003 European heat wave, which Météo France has specifically compared this year's event to in terms of raw intensity, ultimately killed an estimated 70,000 to 80,000 people across the continent over roughly 16 days, a figure that only emerged after weeks of detailed post hoc statistical analysis following the event. At the time it happened, initial reporting captured only a small fraction of that eventual toll, because the full scale of the disaster only became visible once researchers had time to properly compare mortality data against historical baselines. More recent summers tell a similarly sobering story. The summer of 2022, previously considered one of the deadliest heat-related summers in the past decade, was ultimately linked to more than 61,000 heat-related deaths across Europe, according to research published in the journal Nature Medicine, with a subsequent, more granular analysis using daily rather than weekly mortality data, revising that estimate upward to just over 70,000 deaths, published separately in the Lancet Regional Health Europe. Researchers involved in that work noted that this happened even though many countries, particularly France, already had active heat prevention plans in place following lessons learned from the catastrophic 2003 event, suggesting that existing adaptation strategies, while helpful, remain insufficient against the scale of heat Europe is now experiencing. The summer of 2023 saw an estimated 47,690 heat-related deaths across the continent, with researchers noting that women faced a mortality rate 55% higher than men, and people aged 80 and older faced a mortality rate 768% higher than those aged 65 to 79, illustrating just how disproportionately extreme heat affects the oldest and most physiologically vulnerable members of the population. In the summer of 2024, the hottest on record in Europe at the time, according to the Copernicus Climate Change Service, produced an estimated 62,700 heat-related deaths, with researchers from the Barcelona Institute for Global Health noting that 2/3 of those deaths occurred in southern Europe, and that Italy, with Europe's largest proportional elderly population, recorded the highest absolute death toll of any single country for 3 consecutive summers running. Given that pattern, the honest expectation among researchers is that this year's confirmed toll, currently sitting at thousands of documented excess deaths in Germany alone during just a single peak week, will very likely climb substantially higher once complete continent-wide mortality data becomes available and proper excess mortality analysis can be applied across every affected country rather than just the handful that have released preliminary figures so far. There's also a less obvious category of heat-related death that rarely gets folded into these statistics cleanly: drowning. As temperatures soared past dangerous thresholds across multiple countries, people in reservoirs, and a meaningful share of this summer's fatalities came from swimming accidents rather than classic heat stroke. In France, specifically, dozens of additional deaths were attributed to drowning since the heat wave began, with the French Prime Minister directly linking those drowning deaths to the extreme temperatures that drove desperate people toward unfamiliar or unsupervised water in search of relief. Public safety officials note that this pattern tends to repeat with almost every severe heat wave, since sudden mass seeking of water-based cooling by populations unaccustomed to managing that risk consistently produces a spike in accidental drownings that exists specifically because of the heat, even though it will never show up in a heat stroke statistic. Belgium's Public Health Institute, describing the June heat wave that struck the country, noted plainly that a certain amount of excess mortality is expected during any heat wave, in the same way it is expected during severe cold snaps or major flu epidemics. What distinguished this year's event, according to their own assessment, was its exceptional breadth, meaning the sheer geographic scale and simultaneous intensity across so many countries at once, rather than any single record-breaking peak temperature in isolation. That framing matters because it shifts the story away from any one dramatic thermometer reading and toward the much larger, much harder to visualize reality of an entire continent's population being stressed simultaneously for an extended period. Researchers monitoring this year's toll are also paying close attention to how it compares against the World Health Organization's broader multi-year context, which has cited roughly 200,000 heat-related deaths across Europe over the past 4 years combined. Whatever final figure this year's heat wave ultimately produces will be measured against that grim 4-year baseline, and researchers say the trajectory so far, given the preliminary numbers already being reported from individual countries, suggests this year is unlikely to be an exception to the pattern of consistently rising heat mortality that has defined the past several European summers. Part of what makes scientists describe this as something requiring ongoing monitoring, rather than a single event with a fixed, knowable toll, is the layered nature of how the data becomes available. National statistics offices need time to finalize all-cause mortality figures. Epidemiologists need that complete data to properly model expected baseline mortality against actual mortality. Climate attribution scientists then need that excess mortality figure to run the additional modeling required to estimate what portion of those deaths were specifically attributable to human-caused warming rather than heat in general. Each of these steps takes time, and each step typically reveals a higher number than the one that came before it, which is exactly the pattern researchers expect to see play out again with this year's figures over the coming weeks and months. There is a structural reason this keeps catching public attention off guard every single year. News coverage of a heat wave is inherently tied to the event itself, the temperature records, the emergency warnings, the immediate deaths reported while the crisis is unfolding. Once temperatures drop and the emergency alerts stop, public attention moves on almost immediately to the next story. But the actual scientific process of determining the true death toll is only just beginning at that exact moment, which means the most important number, the one that actually captures how deadly the event truly was, tends to emerge weeks or months later, long after most people have stopped paying attention to the story at all.